So yeah, thanks for doing this, Kerry. Kind of just as I'm working with students up here in the Boston area and in New England, I've come across a few who are interested in pursuing like a medical career in the Air Force. So as someone who's doing that right now, like you're in the training process, maybe you could talk about like the different kinds of medical career fields there are in the Air Force, at least to your knowledge. Like maybe not all of them, but maybe some of the heavy hitters.
Yeah, so I mean, clearly I'm most familiar with nursing. But I mean, just about every career field that's in the civilian sector within reason, exists. We don't have the specialties like chemo or like things that would basically mean that you're not in the military if like you need that specialty. But like from peds to I'm labor, so from delivering babies up until we have physical therapists for if you get injured. We have all of your eye doctors, dentists, all of those career fields. And like from like the bottoms, like we have our enlisted who are the techs for all of those places, up to like people who go to OTS after already getting all of their education for like doctors. It's a big variety. So our hospitals have it all.
That's awesome. And for nursing, we were just talking about this before we started recording. You can't secure a nursing career through the academy, right? Like what are the pathways to become a nurse in the Air Force?
Yeah, so for a direct accession as a nurse, the easiest way would be ROTC, because you're going through ROTC and you commission and get your nursing degree all at the same time. You could go to the academy with a different degree and then possibly get an ed delay, but that's just going back to more schooling. Like you'd have your degree in whatever the academy offers, and then maybe do an accelerated 2-year nursing program, but that's just more schooling, which is fine if you want the academy life. And then there's also just obtaining your RN degree or your BSN, and then going to OTS, so going to officer training school. But again, like you would then just be delaying because like the wait for OTS is so long at this point. Or if you're a prior enlisted or an enlisted, there's what's called NECP, the Nurse Enlisted Corps Program. I think that's what the CP stands for.
Okay. I think so.
You're enlisted, and you go. They pay for you to go to school. It's similar to like if you're going to UShoes or something, and they're paying for your schooling. They do that for you to go to a nursing program. It's an accelerated 2-year program, and at the end of that, you're attached to an ROTC detachment while you do it, and then you commission, and you're a nurse.
Okay, so in other words, ROTC, doing the path that you did was like the least complicated, the most straightforward. Was it competitive though? I mean, okay.
Yeah, I mean, I would say it's competitive it's just in the nature that nurses are all type A, you know? You're competing with other nurses, and then you're competing with type A ROTC students. But the Air Force always wants nurses. So as long as you're meeting those baselines for like GPA, PTs, attendance, and the ROTC things, they want nurses. We need them.
Okay. Yeah. So like maybe you can talk a little bit about that too, like your experience at UD, because I know we're both like native Delawareans. Went to UD, commissioned through Detachment 128 together, and could you just talk a little bit about like what led you to maybe ROTC as a commissioning program, and then maybe just even specifically like University of Delaware, like what stood out to you about that school?
Yeah, so I mean, I've always known I wanted to be a nurse, since I was really little. So it was kind of deciding where I wanted to go and how I wanted to do that. And so eventually, there was one random day I was in the car with my mom, and I was like, "Mom, I think I want to enlist after I go to school." And she goes, "Well, you mean like after you graduate?" And I was like, "Yeah, like from college." She goes, "Kerry, why would you do that? Like, you're gonna have your degree. Like, you can be an officer, like live the nice life." And I was like, all right. Well, I don't want to go to an academy, Mom. I'm not an academy girl. She goes, "Well, have you heard of ROTC?" And I was like, "No, what is that?" And she called it ROTC at the time. I was like, ROTC?
Yeah.
What? She was like, "All right, Kerry, go ahead, look into it, and then get back to me next week." And I was like, "All right, I will." And so I did, and I was like, wow, like they'll help pay for schooling, like you learn how to be a leader, you learn how to communicate better, all these things. Like, this is awesome. And the camaraderie, which is what I really wanted. And so that narrowed me down into ROTC and the officer life. It's my cat. Um, he's fine. And then so I was looking at schools, and I wanted to stay like to that local area. And Delaware had always been my dream, but I was like, we'll see. So I applied to a couple schools, and I had narrowed it down to 2, and it all came down to my cadre. I went to what was UMBC, University of Maryland, Baltimore County, and I met with their Navy cadre because I was between Navy and Air Force. I was like, I'm not going to go Army. Like, Army and Air Corps is like too hoo-ah. I like the Air Force life. So I talked with the 2 cadre, and honestly, it was just like I just gelled better in the Air Force environment, and that led me to the University of Delaware, which is now my favorite place ever.
Yeah, me too. I know. I can't believe it. It goes by so fast.
Oh my gosh.
Which is unbelievable. Hard to believe that we even graduated almost.
I know. I haven't
It'll almost
been on
be a
campus.
year ago.
Yeah.
I know.
10 days from now was when COVID shut it down. March 13th.
That's right. Yep. Hard to believe.
It's absolutely crazy.
Well, that's cool. So, I mean, at University of Delaware, while you're going through the program, you obviously had to do the full like nursing stuff and all the stuff for ROTC, on top of all the other things in life. Like how did you balance that all? Like what was the hardest year for you, like to do all that?
So I'll speak to my experience, but I'll also speak to what most other colleges do. My graduating class did this weird program where like we only had clinicals senior year and that was it, which made me all but absent in ROTC, as you remember, because we were partnered up that fall.
That's right.
But the hardest part is going to be, no matter what year your school does it, or any school does it, is clinicals. Because those clinical hours trump anything else. You can't be an RN without getting your clinical hours, which means that you can't commission with that BSN. So the Air Force has to be lenient, but it's all about just like being open with your cadre and like having that understanding that like I still prioritize ROTC, but I can't prioritize it over clinical hours, and like being flexible with them and like having that communication, having your wingman to like catch you back up or like help you in the extra like the off hours.
Yeah, because I know like I know it was a lot. Like I remember you talking about your clinicals and like it's just taking so much time. And that's one of the things I think I talk about with high school students interested in our program. They're not sure like if they are going to have the extra hours in the week to commit to ROTC. And I try to tell them like it's what you make it. Like there were some weeks where I maybe was putting in 15 hours or maybe even more than that. But like when push comes to shove, like you're a student first, like you were saying. So the Air Force, like they can't, you're useless to them if you can't commission and graduate with your degree. So like you have to do that first. And obviously it's paid off for you because you're a nurse now in the Air Force, which is awesome. So where are you now? Maybe you can speak to like the training process.
Yeah.
So once you graduated college, you're a brand new lieutenant. Like you've got
we're not even gonna get that far yet.
The nursing title.
We're not even gonna get that far yet. Unlike everyone else, nurses, you won't commission the same day as the rest of your class because your commissioning is fully dependent on you getting your RN license. You cannot get your RN license until you have your degree. Usually, everyone else, as most people know, usually you graduate one day, commission the next. Literally, bop, bop. Nurses, you graduate one day, you wait for your school to give you your transcript, you apply to the state boards, you wait for the state boards to come around, you take your boards, you wait for your license, yada, 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 and then you can commission. And after that is when you go do training. That's the fun part. So when you're a nurse, no matter what, when you send in, back up even more, we put our base selections in separate from everyone else as well, like before everyone else usually. And we usually hear back before everyone else. I think I sent mine in, I was in Africa. It was like the first week of January of senior year. And I submitted my preferences, and on that same exact form, you submit whether you want to go medical surgical or labor and delivery. And anyone who's in the nursing major will know what that means. But if you're not, it's either labor and delivery or everything else. But no matter what you choose, there's a preliminary training that you have to go to before going to your base. And it's for medical surgical nursing, because all Air Force nurses all baseline Air Force nurses, we're all med surg. If we have to deploy, we're med surg. So we have to be able to revert back to those skills. So when you commission, you then go to one of, I believe it's 3 locations now. There's Eglin in Florida, Wright Pat in Ohio, San Antonio, Texas. I believe those are all 3. For a 2.5 month medical surgical, just nursing training. And it's just like clinical hours with a preceptor. That's basically it. And then you go from there to your base. And that's a good alternative.
Okay. So, and let me see if I get this right.
I know, that's a whole lot.
So, no. So, no, that's good. So your experience was you commissioned, you had to sort of jump through all those other hoops and check those boxes to have like the RN certification, right? Mm-hmm. Am I saying that right?
Yeah.
Okay. And then, so once you have that, then you go down to your initial baseline training, because everybody in the Air Force, like who's like a nurse, you have to know like what to do if you're deployed, and dealing with medical emergencies there. So you get that training. And where was that training for you?
I was in San Antonio.
Okay, so you were in San Antonio, which is one of the 3 locations that you can do.
I'm gonna pull up my form that I submitted just to make sure I'm giving you the right bases. But I'm listening.
Sure. Okay. And then you went to your base of choice, which for you're stationed in Alaska, right? That's pretty crazy.
Anchorage.
But that's not where you are now. So can you talk about what you're doing now?
Yeah, so like I said, there's the 2 tracks you can take, med-surg or labor and delivery. I officially ended up being labor, which I love. I'm delivering babies every day. But in order to be a labor and delivery nurse, the Air Force doesn't trust your school. They don't trust the fact that you have your RN and you are licensed. They want to ensure that you're like up to par to be able to just be autonomous and give all do your whole job on your own when you get to your base. So I'm down in Arizona right now, which is a first-time location for the training. It's usually only in San Antonio, but now they're broadening it to Scottsdale, Arizona, which is beautiful. It's sunny and 75 right now.
That's awesome.
I know. And I'm here for 4.5 months for a labor training, which is like similar to the med-surg, but just labor. So I have a preceptor. We have like checklists. We have to like get me all these different experiences, get autonomous. I'm like perfect my craft and whatnot. And then I go back and I get to be a nurse.
So then you go back to Anchorage, and then that's where you're gonna. Like, how long are you there for? Is it just kind of like a regular, like assignment, like 2 to 4 years somewhere in there?
Yeah, so because it's OCONUS, it's 3 years. But technically it started in November when I need a cough, oh my goodness. In November when I left San Antonio. So it'll be 2.5 years by the time I get back up.
Okay, gotcha. And then what's next for you? I mean, are you thinking, what's the minimum active duty service commitment for a nurse in the Air Force? 4.
So it's similar to anyone else. It's similar to the line officers. It's the 4-year active, 4-year anything else.
Okay. And are you thinking of doing like the minimum active duty service commitment and then transitioning or making a career, or just not sure yet?
I'm not totally sure yet. I want to do more than the 4. I've always been told like get two stations in, go to 2 different bases, and like if you don't love either of them, like get out. I already love my first base, but I also want to go to Europe and like do all that fun stuff. And ideally, if I can use the Air Force to give me more education, I'd love to get my D&P, go to USHUs, continuing education.
And what are those 2 things? Is it DMP and USHUs?
Doctorate in Nursing Practice.
That's okay.
And then USHUs is the military hospital, or like the hospital for military personnel in DC.
Okay, awesome. And they also have a training program if you want to, like, not saying that you would want to do this, but if somebody wanted to go through ROTC and then become like a doctor in the Air Force, they would either check out USHUs or the Health Profession Scholarship, right?
Yeah. Mm-hmm.
Okay.
The nice thing about USHUs is you can go back at any time. I'm not positive about HSPS, whatever that acronym.
I'll have to ask Cindy about that because that's what she's doing, right?
Mm-hmm.
Yeah.
And I know
Cool.
it's very tricky
Um,
because like they have to approve the schools and like all this ahead of time, and there can be a lot of like fine print. But it's a really awesome opportunity.
that's cool. So like for anybody who's maybe thinking about doing this, like if they're like a high school junior or high school senior, and they're thinking about wanting to become a nurse, first of all, like let's start there. Why is ROTC, Air Force ROTC particularly, like why is that a good option to complete the training that you need to become a nurse?
It's interesting being a military nurse because it's two very, very, very different personalities. Um, like you'll go from I remember like when I was a trainer sophomore year, I would go from like just screaming at people to walking into a sim lab and I'd be like, "Hi, my name's Kerry. I'm gonna be your nurse today. Like, do you need me to like empty your Foley or like do you need some ice chips? I can get you ice chips." Um, so it's like two very different personalities, but they both require like such like autonomy and confidence and leadership because I mean at the end of the day as a nurse like you are hands on with a patient all day every day. Doctors have give the orders, but you're the one advocating. Like I advocate for my patients the same way any other leader in the Air Force is going to advocate for their enlisted. And I think
Hmm.
like that they translate really well back and forth. And I think I'm a better nurse for being also an officer, like going through that training and gaining those skills. And I also think I'm a better officer for being a nurse. It's
That's cool. Yeah.
yeah, it's kind of fun. It's a
Yeah.
good little
But
balance.
you and it's sort of cool that like you like so is that your uniform that you're wearing right now, your scrubs? Like that's what you would wear to work?
So, no, like yes, but no.
Okay.
Down here because I'm in a civilian hospital, I get to wear these into work. On a base, you
Uh-huh.
will wear your OCPs to the hospital, change into scrubs that are provided by the hospital. Wear those during the day, change back in your OCPs at the end of the day to go home.
Okay. So is it fair to say like being a Air Force nurse is like you said being just a regular nurse, but you have the advantage of sort of that additional training, and then also like in your case, I know you were picked up for a nursing scholarship on ROTC, like not having to pay off some of that college debt. Like, are those just kind of like the extra benefits of doing nursing through ROTC?
Yeah, there's literally, aside from a couple days with a little less sleep than normal, there's like no downside to doing ROTC and nursing. I think like you get to travel, and if that's something that interests you, it's awesome. Like once you're in the hospital, rank really goes out the door. Like when I go to
Hmm.
my hospital, I'm working, there's about 4 lieutenants, and everyone else on my unit that's like bedside nurses are majors. I'm working alongside
Wow.
majors. Yeah, so and you have to walk. Of course, they have like experience. Like I'm gonna still talk to them about like just nursing experience in general. But rank goes out the door when you're working in the hospital. My doctors are colonels, and I'm working alongside with them, calling them at 2 in the morning. Like that doesn't matter. You're just a nurse at that point. So I
That's
think,
really cool.
yeah, you just get to be a nurse.
Yeah. Cool. Well, is there anything else you think like a prospective student should know if they're interested in doing this program, either from your experience in, ROTC at University of Delaware or your experience now, like anything that they should do or questions they should ask to prepare if this is something they want to explore?
I just think there's no harm in trying. Like I loved like that ROTC. You could come and give it a semester and see how you felt, and like in that time, you'll think of questions too. Like there's no reason to like shut it down if like if you're thinking about it but don't know if you have the answers. Like you might just not be sure. Just try. Like try ROTC because probably you already know you want to go the nurse route at this point if you're looking at this, and now it's kind of deciding how you want to get there,
Yeah.
what you want to do with it. Um, there's no harm in trying ROTC. You can hate it. People hate it. It's not for everyone. But it's that few, especially with nurses, it's that few little, there's a little niche of people that fit that combination of like nursing and leadership, and that you'll know it's for you once you get into the position. Like you'll know.
Yeah. Yeah. That's cool. Awesome. Well, thanks so much, Carrie. I appreciate you spending some time and sort of sharing about your career and about the nursing opportunities in the Air Force.
Yeah.
I certainly learned something today, even though I've known you now for a little while.
A bit.
So yeah, thanks so much.
Yeah.